Hello, everyone. Welcome to our podcast. We are your hosts. I'm Miel.
I'm Megan.
And I'm Ryan.
And our goal with today's episode is to provide a bit more information about SSRIs, which are an increasingly common treatment of depression, anxiety, and other mental health disorders.
SSRI is an acronym for Selective Serotonin Reuptake Inhibitor. Fancy, I know. But let's break it down to be a bit more digestible. Serotonin is a common neurotransmitter, which is a lot of people know about. It's responsible for aspects of happiness, and a lack of it is thought to contribute to a variety of mental health conditions.
Those mental health conditions can range from anxiety to depression and even eating disorders like bulimia. Patients of all ages and demographics often see their primary care doctor or a psychiatrist who will prescribe these medications to them as a way to help cope with the symptoms associated with their disorders.
It may seem extreme to take medications for your mental health, but in reality, it's not. Over 20% of adult Americans deal with some form of mental illness, most predominantly generalized anxiety disorder or major depressive disorder. And that is for all adults. Young adults, like Gen Z, actually have a much higher percentage of about 42%. That's almost half of our population.
And it is estimated that over 50% of Gen Z take daily prescription medications, SSRIs taking up most of that category.
Wow, that's a lot.
Tell me about it.
I know, they are so common, and everyone listening probably knows a few. Zoloft, Prozac, and Lexapro are all common SSRIs, but there are so many more out there. We know quite a bit about how each medication works, and patients are able to find which one works best for them.
And it is true that SSRIs help in the short term, but we honestly don't know nearly enough about how SSRIs impact humans in the long run.
True. It's often seen as a medical necessity for the patients that use them, despite the fact that we don't know much about what happens long term.
Many researchers are actually looking into that, more specifically how SSRIs affect neuronal health. That is what our group found most interesting and what we are specifically focusing on for this podcast.
We all read some articles conducted by researchers, and we want to break it down for you. These are the real experiments and real results, and if you are on an SSRI or plan to be, it's important for you to make an informed decision.
At the end of the day, it's up to you and your doctors to decide what is going to work best. We are not medical professionals. We just happen to be pretty passionate about SSRIs, and we want to share what we know. I guess that leads well into my article. It was actually published this year, and it's really recent and groundbreaking for what it has to say.
Go ahead.
Well, first off, this study wanted to see how SSRIs affect pain response in the long term. Prozac is a really common SSRI, and its prescription frequency rose drastically during 2020.
Wait, why is that?
When everyone was in lockdown, people were isolated and needed therapy more than ever. The problem was people couldn't go into therapy. They had to stay home. So talk therapy wasn't as efficient for a lot of patients, and lots of people needed a medication to help them out. The most common demographic was pre-adolescent and adolescent girls.
Wow, that's really young to start dealing with mental health problems.
I can't imagine being a kid during lockdown. That's when you're supposed to socialize, and it's really foundational for development to be able to interact with others.
Honestly, yeah, which is why so many kids started taking the medication. Anyways, in this experiment, they administered fluoxetine to rats while they were developing, stopped it as adults, and then ran 2 different tests. The first was just weight measurements, and the second was pain response.
Well, why those two?
Prozac was actually originally used to treat bulimic patients, which is an eating disorder. It sort of stops patients from wanting to binge eat, which can manifest in the form of reduced appetite. That's why we were interested in weight. They were interested in pain response because there's a tie between emotional and physical pain. Prozac has actually been prescribed for pain management before.
How does an SSRI help with pain management? Like I get you said there's a link, but pain isn't really related to serotonin.
That's a really good point, and I honestly don't know, and I'm not sure if researchers know either. All we know is patients report that as additional side effect of the medication.
I mean, I think that's one of the reasons why research is so important. We need to know what we don't know about medications.
Exactly, and in addition to long-term side effects of SSRIs, we don't truly know why Prozac helps with pain management.
Gotcha. So what were the main takeaways?
The article was straight and to the point. Prozac reduces weight gain over time and also increases pain response.
Is this surprising news?
Sort of. The reduction in body weight was expected, as Prozac helps prevent overeating. The rats on Prozac were not malnourished, which was good, just a little skinny in comparison to the control. As for the pain, I think it's really interesting. I mean, something that is meant to help you cope with pain ends up making you more sensitive to it in the long run. It's weird.
Do you think it might relate to neuroplasticity and maintaining equilibrium?
Yeah, sort of like how recreational drug users eventually get so used to taking them, they sort of get dependent on it and it takes them a while to get back to normal.
It very well could be, and that's personally what I would hypothesize. The researchers actually didn't dig into that, so I guess someone else will have to learn more.
Interesting. So, how should patients consider this info?
Well, I guess it depends. I think the weight loss aspect might actually be good for bulimic patients because it shows that the drug will continue to work even after discontinuing it. As for the pain response, researchers said that chronic pain conditions might be more severe in the long run.
Wow. And I guess when you were young, you probably don't have any yet. Diabetes, fibromyalgia, and everything else comes later in life.
True, but also some patients that take this are struggling to see a future. The possible side effects may not even be important to them considering they're just struggling with their day-to-day lives.
Yeah, I think that's where a lot of patients are at. I'm actually on Prozac for depression and have firsthand felt the effects of reduced appetite, but not so much increased pain response. However, like I said, I'm still taking it, so I don't really know about the long term. I will say the test they conducted was with a reflex when rats were on a hot plate. Though it was statistically significant, the difference between the two wasn't startlingly drastic. The link to all the articles we're going to discuss are in the description, so if you want to check out the exact numbers, feel free to. Anyways, it is still something to consider when starting a medication, but their findings didn't change my personal decision or make me want to discuss alternatives with my doctor.
Well, it's reassuring that the difference in average time response wasn't too large. Like you said, it's definitely still important to be aware of, but all mental conditions come with some side effects. If you are medicated, you may have long-term side effects, but you might have different ones with different medications.
And like we said earlier, some people's symptoms are too severe to deal with when unmedicated. It is all a personal decision about weighing the risks and benefits associated with the treatment.
Exactly. Well, was there anything else the paper said that was particularly profound?
Honestly, not really. It was a pretty short paper, but I think what it had to say was pretty important. To be honest, I think that's about it for my paper. Unless you guys have any more questions, someone else can take it away.
I don't. Meow?
I don't either. I guess I'll take the reins. Now, as we've touched on already, SSRIs are prescribed for a reason. By preventing serotonin reuptake in the brain, users are hopefully able to hold on to more serotonin for longer, which can result in an increase in motivation as well as an improvement in mood.
Yeah. SSRIs are often used to treat depression, which is where it can be beneficial for many people who take SSRIs. Depression can sometimes be associated with an increased reuptake of serotonin, which leads to feelings of sadness, hopelessness, and a lack of motivation.
However, there are concerns and drawbacks to taking SSRIs as well. When a person first starts taking SSRIs, for the first 4 to 6 weeks, they have to make sure they are incredibly self-aware, have a good support system, and are regularly checking in with professionals who prescribe the SSRI.
It's interesting that the reason for this is when the serotonin reuptake is first being inhibited, it will increase motivation, but it won't necessarily improve a depressed mood.
This puts users at a risk for having the motivation to carry out any suicidal or self-harm notions they have been considering prior to taking the medication, but didn't have the motivation to complete.
Another study we had analyzed studied the use of an SSRI called citalopram. The results of this study showed evidence of harm to the brain function of serotonin. It also showed slower reflex and startle responses. The researchers hypothesized that this was due to reduction in memory, which serotonin also plays a role in, aside from mood and motivation.
When it comes to personal accounts of SSRIs, I myself have also been using SSRIs to treat my depression for about 3 years now. I have used the SSRI sertraline, or more commonly known as Zoloft, and I've had a mostly positive experience while using it. Like many others, I've experienced negative side effects when I neglect to take my medication for a few days, the main symptoms being headaches, vertigo, and dizziness. It's frustrating that I have to take a dose daily to mitigate my depression and avoid those negative withdrawal symptoms, but overall, it's provided me with a way to cope with my mental illness. I would also recommend that others combine medication treatment with lifestyle changes that work for them, as well as counseling and therapy. I have done this, and the combination of these treatments definitely helps. And I think it's especially helpful to recognize the stigma and perceptions around SSRIs and what people are concerned about happening, which brings me to the article that I read for this podcast.
Tell us about it. What was the study about? What did it reveal and inform us?
So this study actually took kind of an interesting approach by looking at common internet searches about side effects from taking certain types of SSRIs. It was basically able to inform us about the concerns people have either while taking SSRIs or before they start to take them.
What would you say your takeaway from the study is?
I mean, I would say it's important to talk to professionals and do your own research before taking SSRIs. You can't be certain what effects you may experience while taking these medications, but you can get a good idea of which ones are common and may apply to you.
What things were recognized as topics to keep in mind for potential future research?
Well, one thing the researchers talked about was the importance of doctors in knowing their patients and their needs. They talked about how while this mass internet study was not to be used as a primary source for diagnosis, it's important to recognize the concerns patients have about taking certain medications and how to work with those concerns in prescribing the best possible options. They also acknowledge the limitations and how searches about symptoms don't actually equate to the real-world experiences of these symptoms.
What do you think is important for people to understand about this study?
I mean, kind of what I already touched on. It's a two-way street. People need to consult medical professionals about a prescription for SSRIs, and medical professionals need to listen to their patients about their concerns. It's important to have a clear understanding between both parties.
That's great advice. Bringing us to our final article of discussion today, Ryan, could you give us a little overview of what it's about?
Of course. The study looked at how discontinuing a specific SSRI called paroxetine would impact serotonin function in mice, which basically means the researchers were investigating the mechanisms behind using these SSRIs as treatment for a long period of time and then stopping them abruptly.
That sounds interesting, but why would that be important?
Well, for anyone using or thinking about using SSRIs, it is important to know the long-term effects, especially before you abruptly stop using them because of various reasons.
That makes sense. So, what did they find in the study that seemed to be of importance?
They found that ending a treatment course quickly can lead to disabling discontinuation syndrome, which is a whole other topic, but in these terms means bad and sometimes severe effects from discontinuing treatment abruptly. They also discovered through multiple experiments that stopping the SSRI treatment was linked to an increased serotonin function at the neuron level. Furthermore, they found that the longer the treatment, the more significant and obvious the effects were.
So, what is the one thing that you would leave us and the audience with?
I'd say that if you're looking into SSRIs, to look into all the aspects and definitely seek professional opinions before deciding one way or the other.
So, now that we've touched on a few research articles, in conclusion, after looking through the articles from both recent and old, what are the main takeaways?
Well, we know that SSRIs are intended to keep serotonin around for neurons to be able to use by blocking reuptake sites. We also know that these SSRIs, while beneficial in treating depression and other mental conditions, can have some other effects associated with them. These effects have been continuously studied over time and being more increasingly looked at as the use of SSRIs has increased in recent years and is a very common thing nowadays.
So, just a recap. What are the main side effects, good or bad, that we should know about when it comes to SSRIs?
The main side effects of SSRIs seem to be linked to stopping SSRIs, especially after long-term use. This is shown through many research articles, some of which we've mentioned in this podcast, but there's plenty more out there. The important thing is to recognize that each individual is different, and you should go through the effects of each specific SSRI with a medical professional.
Another thing to add is that SSRIs are intended to be treatment options to help all sorts of conditions and shouldn't have a negative stigma around them. We should continue to learn about them and other treatments we are unfamiliar with before we jump to conclusions about them. Overall, lots of research has been done and lots more is still needed to determine all the effects of SSRIs. We look forward to continuing to learn and to share our knowledge on the topic with you.